Once you have connected your wireless ultrasound probe to your phone or device, we are now ready to start scanning. Here we are scanning the neck area, looking at the carotid artery and just seeing the thyroid gland coming into view, along with the sternocleidomastoid muscle superior. You will see at the top left hand of the screen the various parameters, from the mechanical index, thermal index, gain, depth, enhancement, dynamic range, and frequency. We are now going to freeze the image by pressing the freeze button at the bottom to show you how you can remove these parameters, as this can be a little intrusive on smaller screens. This is done in presets at the bottom right and by pressing the show information slider. However, we are going to leave this on for the purpose of this video. The first thing to mention are the presets themselves, which are right at the top of the screen. Currently, we are on a thyroid setting, giving you a frequency of 14 MHz with a depth of 40 mm and a gain of 65 decibels. Of course, we have a range of different applications with presets to correspond to them, so just to be aware that this is a quick way into getting the relevant presets for you. Now going down to the bottom of the screen, we shall run you through some of the basic controls. Firstly, we have the gain function, which helps in amplifying the sound waves coming back from the deeper tissues. You're able to increase or decrease the gain with the corresponding button. Time gain compensation is up on the top right of the screen, where you can set to compensate for signals coming back from deeper structures to smooth out the image in that way. Next we have Harmonic, where we can adjust the frequency depending on the depth of your structures and application. Harmonic can be adjusted in this case between 10 and 14 MHz. The Focus function allows us to optimize the focus to improve lateral resolution. Dynamic range allows for the grey scale to be adjusted, right up to a much grainier image depending on your preference. Denoise is another useful function for smoothing out your image. We usually have that set at the mid-range. There are a lot of adjustments you can make to optimize the image for your particular purpose. We are now just going to freeze the image in order to show you the other functions. There is measurement, where you have a range of parameters you can use to measure, such as length, by touching the screen and using the calipers in order to find the depth of that vessel, which is 12.08 mm. This can be cleared by pressing the clear function. Other measurement can also be made around things such as area and circumference. With the Annotating function, you can place a text box on the screen and simply type in the name of your structure, creating labels in your final report. Having frozen the image, you can also now save it. By pressing the left-hand save button, this will produce and save a single frame. Or by pressing the right-hand save button, you can save a small loop of the last few frames. This can then be played back by pressing the play button. You can also choose to fill in patient details and use this as a basis for a report. This generates a recorded image along with your patient report, which can be stored in a DICOM format or whatever your preference may be. That was a quick run through of the basic scanning functions. Look out for future videos going into more details of these varying functions.